In the context of binge eating disorder and obesity, what we find is that stress plays a very important role in the development of the disorders, but more importantly, in maintenance and relapse after treatment. Stress is a common trigger for consumption of large amounts of food, and there's a tight relationship between those two things: the stress and food craving and overconsumption of high-calorie foods. What we find is that there's an association and a connection at the level of the brain and the body, and dysregulated metabolism, as well as dysfunctional reward and stress pathways in the brain contribute to this tight connection between stress, binge eating, and obesity. There are definitely techniques out there to address stress. We are actually implementing those in our programs. There are stress reduction programs like the mindfulness-based stress reduction, mindfulness training that focuses on eating. There's an adaptation of the mindfulness training that focuses particularly on food craving and overconsumption. And we find, and some others have found, that it does help with controlling cravings and some impact on weight when it's combined with other aspects like nutrition and physical activity. So in terms of behavioral approaches that can be applied to help patients with addiction, cognitive behavioral therapies have been shown to be effective. And those are really therapies that focus on helping the client think about the problem at hand, learn new problem-solving skills. How do you prevent a relapse? How do you plan so that you don't put yourself in situations that could lead to relapse? Getting away from triggers or things that are weaknesses, so to speak, or things that will increase cravings, and so on and so forth. So the question is about the clinical use of relaxation. I think relaxation is sort of an umbrella term. There are lots of different strategies for relaxation. There's progressive muscle relaxation, which is used in the treatment of anxiety disorders. I think there is definitely a place for relaxation therapies. We like to use a breath-related relaxation, so a really breath modulation and a series of breathing techniques that have been used in yoga as well as in mindfulness that focus on really bringing the reactivity of the brain and the body and the tension level down. And there's a real purpose for that, because that can help with decreasing how quickly you may react under stressful conditions, and also may allow the person to think about cognitive strategies or better ways of dealing with challenging situations. So there are several other components of our research that are contributing to our understanding of treating patients with overeating and obesity. And one of the things that is very important is that as we start to put on weight, there are changes that occur in our metabolic hormones and in our metabolic state. Even before you become fully insulin resistant, insulin sensitivity goes down. Glucose levels in response to eating large, high-calorie meals may be really high, and that can affect the brain and the body. So that's very important and a new aspect of the research that we're doing, that the metabolism is directly affecting the brain. And so in our program, in helping patients, we actually include, even before somebody may have diabetes or a medical complication related to obesity, we will have them meet with an endocrinologist, screen for other biological factors and metabolic factors that may be influencing food cravings and overeating, and begin to assess that for treatment. So combining that with behavioral approaches is a very important aspect of what we are finding.